Harris Laboratory was established in late 1960s, and our primary goal is to help improve the outcomes in total joint patients.
I call it a truly translational laboratory, and that is different than typical academic laboratories where the horizon is possibly 10 years, 15 years for developing a technology. We are really in the midst of the clinicians and the clinical environment, and therefore we are always focused on bringing something useful to the patients to fruition.
The laboratory has multiple groups. One group of us are actually working on basic science and basic materials technologies. Another group is working on designing more functional and better performing implants. Another group is carrying out most of our animal studies. And our fourth group is doing all our clinical trials with patients.
At the Harris Orthopaedics Lab, we have a long history of developing ultra-high molecular weight polyethylene as a bearing surface for joint replacements. We have tried to solve many problems, including osteolysis, over the years.
Today, data that's coming from many different centers around the world shows that with the use of the highly crossing polyethylenes, the extent of periprosthetic osteolysis is reduced substantially. Now that that problem is behind us, we are now focusing our research efforts on the other problems in joint surgery.
We are now focusing on infection because this is a very morbid condition that affects about 1% to 2% of all patients. So we decided to use the bearing surface that is currently being used and introduce antibiotics into the bearing surface so we can have a fully functional implant, but at the same time be delivering these medications in a controlled manner to treat infection. I'm working currently on a large project putting pain medication into these bearing surfaces. This is a slightly different application, but it's very timely because, as you know, we have an opioid epidemic in our country, especially in our state, and we are trying to find ways in which to address post-surgical pain with non-opioid medication locally so that the patients don't need to use as much opioids systemically. And this is very exciting to me, and I hope that in the next couple of years we'll be having some great results on this project.